Hi, I'm Dr. Charlie Liu, and today I'm going to be talking a little bit about using steroid creams in maintenance regimes to control eczema. So this is part 3 of a series of videos on how to self-manage your eczema. In the first couple of videos I talked about using emollients and hydrocortisone cream, and those were mostly aimed at people with relatively mild eczema who might have the occasional flare-up, a few flare-ups a year. This video is going to be aimed more at people who have slightly more severe eczema, that's red and itchy on a regular basis, but everything I talked about in the first two videos does still apply. So I'm going to be using a fictional person to use them as an example here. So let's say we have Ellie, who's 25 years old. She's had eczema for a number of years, perhaps even since she was a child, but it has worsened over the last couple of years. At some point in her past, Ellie's gone to a GP who's told her about the side effects of steroid creams, and because that's kind of scared her a little bit, she is trying to use steroid creams as little as possible, and when she does eventually use a steroid cream because the symptoms are getting a bit too unbearable, she tries to use it for a very short period of time and uses a very, very small amount. And it's only really when the itching is getting unbearable that she calls up the GP and gets a tube of this stuff. So when the flare-up is really, really bad, she sometimes tries to start off with the hydrocortisone cream and actually finds that it's just not strong enough to work. It doesn't really do anything, and sometimes it may even sting and cause the eczema to seem like it's flaring up even worse. So she really needs the powerful stuff sometimes when the eczema is flaring up and it's really bad. And then as soon as the itch is bearable again, after 2 or 3 days of using the steroid creams, she is slightly scared of overusing them and get the side effects, so she will stop using the steroid cream and just try and grim bear it until it gets really bad again. So at the moment, let's say she comes into the clinic and it's about as bad as it's ever been. Her skin is really itchy all the time. It's quite widespread. It used to be just the elbows and the knees, but now it's affecting the neck, the face a little bit, quite a lot of the body. It's affecting her sleep, it's affecting her job. She works face-to-face with clients, and it's embarrassing to have the constant itch and sometimes be scratching away, and she's just desperate to have something done about it. Now, if that sounds familiar, then hopefully this video is going to give you a few tips on how to manage this. And at this level, we're probably talking about something that's going to be overseen by your GP. So you might have a regular review with your GP, particularly when you're starting out and you're not quite sure how this all works. But basically, we're going to be using a maintenance regime for Ellie in order to try and get the eczema under control. So there's a few different things that are going wrong here for Ellie. Now, if you watch the first couple of videos, you'll have heard me talk about the skin barrier and the itch-scratch cycle. Now, because Ellie isn't really allowing her flare-ups to resolve every time she gets one, that means her skin's remaining inflamed and it's going to itch. And if she itches, she's invariably going to scratch, and that means that her nails are going to be digging away at her skin barrier and breaking it down even further. And that means that irritants from the environment are going to be able to get through. That's dirt, allergens, pollen, bacteria, viruses, all sorts of things are going to be getting through the skin barrier where they shouldn't be and irritating the underlying tissue. And when they irritate it, they inflame it, and that just causes more itching, and then we go round and round in that classic itch-scratch cycle that we've already talked about. So basically what we need to do to start off with is that Ellie's come in and she's clearly right in the middle of a bad flare-up. So we need to get that under control to start off with before we start talking about a maintenance regime. So we need to use a decent strength of steroid, not just the hydrocortisone cream, but probably something moderate or strong potency in order to get the eczema well under control. And ideally what I want to do is to try and get it 95% under control. I want the redness to almost entirely go away. I want the inflammation to almost entirely go away. I want the itching to almost entirely go away. As a rule of thumb, I generally tell people it needs to get to the point where you can confidently go to bed and turn out the lights and be fairly sure that you're not going to start scratching when you're half asleep. Because if you're scratching, then you're just going to be perpetuating that itch-scratch cycle. You're going to be breaking down that skin barrier, and you're not going to get anywhere. So we need to get to the point where you can be half unconscious and you're not going to be scratching away because it's not itching, hopefully. So the different types of steroid creams that we'll use are stronger than hydrocortisone cream. The moderate strength ones, probably the most common ones that we use in the UK, are Umivate or Betnovate ointments. And these ones are not ones that can be bought over the counter. These will have to be prescribed by your GP because we don't want you to overuse them really. And then above that strength, the potent ones, things like Elicon or Mometasone. And then there's the super potent ones, which we use in rare cases. So Dermavate is probably the most common one that we use. But ideally, we want to use the lowest strength one that we can get away with. And quite a lot of the time, people will manage with some Umavate or Betnavate, which is the kind of the second level strength. So we want to use that for up to 2 weeks, and ideally, try and get that eczema flare-up under control. It doesn't have to be the full 2 weeks, but whatever is needed in order to stop the itching and stop the redness. And then once that's happened, once the flare-up is under control, then we can start stepping down to the maintenance treatment. So what we do with maintenance treatment, there are a couple of different regimes out there. The one that I most commonly use is something called weekend therapy. So this is when you apply a dose of steroid cream, a decent dose, once on a Saturday, and then another decent dose once on a Sunday. And then for the rest of the week, you don't apply anything apart from your normal emollient creams, your moisturizers. And hopefully what that does is it stops the inflammation from starting up. It basically never allows the eczema to get to a point where you're starting to scratch and you're starting to break down that skin barrier, so that its scratch cycle should hopefully never get started. And that's the idea, is to try and suppress those flares. Now, for whatever reason, the flare-ups might still occur. You might have an infection, you might be exposed to allergens. Let's say you're looking after your mum's cat for a week and you happen to be allergic to cats. You might still end up having a flare-up of eczema. And if that happens, you are going to have to go back onto the higher strength of steroid and use that regularly for a week or two, just to get it under control before you go back to the maintenance regime. So hopefully we have some benefits from using this maintenance regime, which are better than what Ellie was doing before. Number one, and probably most importantly, is that you're not miserable anymore. So Ellie can now go and kind of live a normal life without constantly worrying that she's going to be itching and scratching all the time and suffering from that embarrassment. And the appearance of the skin is also going to be better. It's hopefully not going to be red and cracked all the time. Number two, overall, is that most people actually end up using less steroid using the maintenance regime rather than more, which seems a bit counterintuitive because obviously we're asking you to use it on a regular basis. But the idea is that by avoiding flare-ups and not having to use the high-strength steroid for regular amounts of time, and just using the relatively weak steroids, once on a Saturday and once on a Sunday, that's only 2 days out of the 7 days of the week, and actually that's not that much. And hopefully by maintaining the skin barrier, less of the steroid cream is going to get absorbed, and so the systemic side effects and the general side effects are hopefully going to be less than if you were constantly having flare-ups before. So yeah, number two, the surprising one, is that most people will probably end up using slightly less steroid than they were using before. Benefit number three is that we're avoiding the consequences of long-term inflammation. So long-term inflammation, particularly the scratching that happens, can lead to a process called lichenification, so like lichens essentially, where the skin becomes thickened and kind of coarse. You can Google image, you can do a Google image search and look at what lichenification looks like. And this may be something that you're already experiencing, but if your eczema has been out of control for a little while. And hopefully if we manage to keep the eczema under control, that lichenification will essentially start to ease away, and you might go back to having relatively normal looking skin after a while. So that's benefit number three. And number four doesn't really apply to 25-year-old Ellie, but if she happened to be 2 years old instead of 25 years old, then there is this additional potential benefits. Some immunologists now believe that the way the immune system develops in younger life is all to do with what you're exposed to and what your immune system learns about what's a threat and what's not a threat. So obviously allergies occur because the immune system is mistaking something that's benign for a threat. Pollen does no damage to your body, and yet the immune system kind of freaks out about it and thinks that it's a threat and starts releasing these inflammatory chemicals. And so some immunologists think that when your skin barrier is compromised at an early age, that things are getting through your skin and they're sort of tricking your immune system in the wrong way. So actually an intact skin barrier is very important for letting your immune system train itself properly. So if you have eczema and it's not under control, potentially that could lead to things like food allergies and other allergies. So that's benefit number four. Now there's an excellent leaflet that is produced by Oxford University Hospitals, which I'm going to send a link to in the description below. It's called Get Control, Keep Control. That describes the process that I've just talked about in this video in a bit more detail. Ideally, what we want to do is when the eczema is flaring up, we use a decent strength of steroid for up to 2 weeks to get the inflammation and the itching and the redness 95% down. And then after that, we step down to a maintenance regime and we try and stop any flare-ups from happening. And what we're aiming for when you're on the maintenance regime is essentially pretty normal looking skin. You don't want the skin to be red. You don't want it just to be mildly itchy. You want it to be normal. That's what we're aiming for. So hopefully that is a little bit of information about maintenance therapies. And like I said, this is probably something that at the start you're going to have to discuss with your GP just to know exactly what strength of steroid is right for you, both for the flare-ups and for the maintenance regime. And then once you're a bit more confident with managing it yourself, you probably won't have to see your GP very much. You'll just be able to manage, and you'll only be contacting them when you need a stronger steroid cream for a flare-up. So hopefully that's been useful. Do check out the leaflet below, which is going to be in the link. If you're struggling to keep control of your skin, even using those regimes, then you'll probably want some additional input. So do speak to your GP, and it may be that your eczema is severe enough to actually warrant referral to a dermatologist and some further treatment from them. I won't be talking really about any of those things like wet wraps, tacrolimus inhibitors, immunosuppressants, light therapy. It's a bit beyond my pay grade, it's a bit outside of my expertise level, and so I'm going to leave that to the dermatologist. But if you're finding that the stuff that I've talked about in these first 3 videos isn't keeping your eczema under control, that's probably the time to ask for a dermatology referral. But I hope that has been useful. If you do have any further questions or things that you'd like me to clarify, leave them in the comments below and I'll try and answer them as best I can. I think I will probably be doing a 4th video, which will be the last one, and that's just talking about general tips to avoid itching so that you are not scratching your skin as much, and then hopefully addressing some frequently asked questions. So some of the things that I commonly get asked in clinic, like, is my eczema being caused by allergies? How much steroid cream can I use without getting side effects? Those sorts of things. So do keep an eye out for the 4th video, and I hope that's been useful for managing your eczema. Have a very nice day.